Hi, everyone. It's Dr. Hillary from Rangeline Chiropractic. I am here with a special guest, Lateva. She is going to talk to us about birth advocacy. So she is the owner and blogger of All Purpose Women. And fun fact, she has 6 kids. Hello there. Why are you crazy with 6 kids?
Who did that? Who did that? I wonder every time I say it out loud, like, who
do you think, like, is that really? Oh, I do have 6 kids.
I do have 6 kids. I do want to explain because I tell people I have 6 kids, and I feel like in their mind it's like in my house. So we have our older set of kids. We have 15 today. Today is my daughter Jania's birthday. She turned 15. And then we have 12 and we have 11. And then we have a huge gap of 5. I say huge because I feel like it's a huge gap of 5 years. And then we started all over. We had decided we weren't going to have any more children. Mm-hmm. Then we started all over with 3 more girls. So we have 6, 2, and baby's going to be 1 next month.
Aww.
Yeah.
It's a fun house.
It's a fun house some days. Not every day is fun.
Well, we were chatting before you went live how you having 6 kids does make you kind of an expert on some things such as birth advocacy. Yeah. Tell us about the All Purpose Women and jump right into a little bit of like birth advocacy and like when someone's listening, like what does that mean? And anyone listening, feel free to share any comments or questions. Please.
Yeah, I want to know how many kids y'all got. Are you crazy like me with 5 and 6 kids? Like, how's that happening? The All Purpose Woman kind of came of kind of being a little bit lonely here in Indiana. I'm from Michigan, so I started the blog only because I wanted to share stories about like my birth story, about natural birth, breastfeeding, understanding motherhood, and really connecting with a community of women like we all want to, you know, having that mom friend or a friend around the corner that can come and be like, hey girl, I totally understand what's happening in your world. We just connected on, you know, when it's meeting time and your kids are being crazy. So just really connecting on the core issues of motherhood and being seen. Mm-hmm. And switching over to advocacy, that really started when I got here as well in regards to natural delivery. I got here into this world of delivering my last 2 children here and kind of shifting and trying to find a space of natural birth here. And I could not find what I needed to be able to feel safe and seen and understood in that space. So back in Michigan, we have an actual natural birthing unit connected to the hospital, which was beautiful for me because I felt safe in regards to, because, you know, sometimes you feel a little bit crazy when you do natural delivery. You're like, okay, what if something happens? What if, you know, anything, I want to be able to get where the emergency doctor is and not the doula is, because the doula can't do the same thing the emergency doctor does, right?
Right.
Mm-hmm. You know that. You know that. So just in that space, I felt really safe and comfortable, and I had my first 4 daughters there. So it was just a beautiful experience of feeling safe and heard and understood in that space. So once we got pregnant here, I was like, oh, I know Indiana is going to have, you know, a natural birthing unit for me at the hospital. And I got there and it was sterile and cold. And then when I was like, I want to do natural delivery, they were like, yeah, I don't think so. You're of advanced maternal age.
Boo.
And then I was like, excuse me?
So awful when they say stuff like that.
First of all, I was 33. I'm like, am I already
advanced? Oh, no.
Is this what advanced is? Because that's not what was in my mind. Like, I felt like maybe after 50, you would be advanced maternal. Like, they threw the shoe at me and I was not ready for it. Okay. And they were like, you can't do natural delivery. We don't think that we can help you in this space. So I ended up switching doctors at like 22 weeks. Because I just did not feel safe. Like I feel like as a doctor, I want you to love me a little bit, Dr. Hillary. I know. I know you understand.
I already love you a little bit, Lateva.
Love me a little bit. Like when I walk in the room, I want to feel like you're like, oh, hey, Tiva, you're here. How's the baby? How are you feeling? How's your husband? You know me a little bit because I'm going to be spending a year with you. I'm going to be spending a year with you and if you don't know me or you don't say hello to my child, I'm switching doctors. Mm-hmm. So that's what happened. And then I linked here with a couple of researchers at IUPUI, as well as at, what's the other college? I can't think of the name of the other college that has the movie about them.
Is it Ball State?
No, not Ball. It's private. Butler.
There you go. The other one that starts with B. Got it. Yes.
Butler. And they kind of interviewed a lot of women after delivery, what the process was, and just kind of going through how Indiana can kind of better their background in natural delivery. Mm-hmm. So a lot of people have just been asking me questions. Number one, about birthing, and then number two, about birthing naturally, and number three, about finding a doctor that cares enough about you during your delivery. And those are kind of how the All-Purpose Woman was born, advocacy was born, all the things. That's all the things. Other than that, I've just been chilling here watching these kids.
So if someone wants some help or some advice, how do they get in touch with you normally?
Normally, I'm on all the socials. Okay. You can obviously find me at theallpurposewoman.com. That is where I blog all of my thoughts, all of my feelings, as well as putting things together such as, 10 questions to ask your doctor when you're going to find an OB. There's a full list that you can kind of download there as a freebie. I also have a podcast called This Messy Mom Life. Where it's a super fun podcast. My co-host is in Australia. We go back and forth really well. It's so fun. We just tell stories and just connect about motherhood and the craziness of it. Thirdly, like I said, I wear all the hats and do all the things. I also run a membership here in Indiana called Create, Connect, Collab, where you can connect with me on business or ask me questions about, moving forward with being an advocate or things like that. And I'm on IG, of course, at the All-Purpose Woman. I'm over there shaking things up, telling stories, and posting my kids and my husband.
What do people usually ask you about, like, to start off everything? Are they like, where should I go? What should I do? Why do I need a birth advocate?
Majority of the time, people just really want to know personally, like, how and why. Like, that's the number one question I get. Why would you do natural delivery? Or do you, it's that kind of shift in between of, do you get a special prize if you have a baby naturally, or do you get, I'm like, the prize is the baby, but where, why would you put yourself through such things? And that's really the number one question that I get. And I always tell women that the process of giving birth and building a person in your body is a win in and of itself, right? And then the prize is coming through it alive, especially as an African-American woman. Statistically, the numbers aren't the same, just in honestly looking at them. So that's a huge reason of why I became an advocate for women, to be able to ask those hard questions and know that, a doctor should be able to answer them. And if not, they should be able to find somebody to answer them. And you should feel safe and comfortable when you're getting care. And then it is number two, you're crazy. Why? Like, there's an epidural, just do it. Just get the epidural. Get the epidural. And if that's what you want, I advocate for that too. If that's what you want, you do you on how you want that baby to come out. What we want is the baby to come out and for you to be safe once it's out. That's it. Because the numbers here in America are astronomical when it comes to death for women and for babies here. And if you look at our counterparts around the world, the numbers are much lower. So
I didn't know that the death rate was that high. I knew that the cesarean rate is extremely high in the U.S., yes. But I did not know that the death rate was also very high. Okay.
It's also very high, which is amazing because you feel like we're really advanced in regards to medical advances, honestly. Yeah. So it just seems weird, but as long as people like you are connecting and people like me are connecting, we can kind of change the world. I feel like world changers. Yeah.
Well, it's so scary. I have a lot of females that are, first time mom, first time pregnant, and they have the baby, and we joke like they just gave it to you to take home. Like, now, right? You get this child, and you're like, what do I do now? Right?
What am I supposed to do with this thing? I also talk to my doctors a lot about just postpartum depression and understanding the feelings of bringing this baby home, having to watch it, and then by the time mom's checked 6 weeks later, I always joke, this is a joke, guys, that I by then I've thrown the baby down the stairs. It's 6 weeks later. Like, you haven't checked on me at all. We checked on baby 3 days later.
Yeah.
Then we check on baby a week later. Then we check on baby 2 weeks later. The baby's going to the doctor and nobody's seeing me at all.
I agree. That is a big problem with our society, not taking care of moms. So I've been trying to preach that to my patients, my pregnant moms, like, make sure you do this and this after. Yeah. And, it's about you too. It doesn't have to all be about the baby. The baby's going to be fine.
The baby's going to be okay.
You just have to feed it and change your diaper. Like, the baby's going to live. That's like the easiest part of the baby. Don't you think? It only gets worse from there. You think crying is bad. Like, you haven't seen anything until you get a toddler or teenager. Right?
So true.
They should be checking on us like decades later after that child.
My baby's 15 today. Check on me now. Okay. Yeah. Like,
that sounds awful mentally right now for you. Oh, goodness.
Let's have a moment of silence for me for the mental stress. Okay. And I have a child in like every aspect of parenthood, I feel like right now. I have a teen, a preteen, I have a toddler, I have a kid, I have a baby.
Yeah.
Pray for me.
Yes, we will. Yes. So the women out there listening, we had a point for today. The point was about birth advocacy. I know I stray off often into my own little tangents, but reach out to Lateva, reach out to myself. If you have questions, if you think something's not going right in your birth plan, because sometimes you just don't know who to ask, right? Yes. And like when you were new to Indiana, right? I guess you weren't new to motherhood, but if you were new to motherhood and not knowing where to go, the questions to ask to make this like a really positive experience, like being pregnant is amazing. Man, giving birth is just it's just mind blowing what our body can do and how we were created. I don't need to tell you because you created 6, so
it's a superhero moment every day. Mm-hmm. It's a superhero moment every day, no matter what happens in between. You got that baby out. You're still here. You're a superhero in my eyes.
Do you do a lot of help or a lot of podcasts about nursing? Because I also feel like that's like a hot topic with a lot of the patients that come in.
Nursing, I nursed all 6 of my girls. Mm-hmm. And we haven't talked a lot about it on the podcast. The podcast is really about a bunch of things. And we interview moms all the time in regards to, what they have going on. Like yourself, Dr. Hillary, we introduce women to saying, hey, I'm a mom. I've done this, and this, and this, and this. You still matter, honestly. Mm-hmm. Nursing, I just feel like that's a whole nother segment at this point. Because feeding a person, I do feel like a winner. Like, I fed this person with my body only. And that is normally my argument with my husband. I fed a whole person with my body only, and it's grown. Like, it grew up. Look at it. What did you do with your life? What did you do with your life? I fed people. But that's also like a stressor in regards to, postpartum depression and understanding your feelings and, kind of still even being closer to the baby. So I advocate for breastfeeding, but I am the mom that's like, however you feed that baby, that's how it should be fed. That's it. If you're not stressed, if you don't want to stress yourself, you want the baby to eat and not be, kind of crying everywhere. Feed the baby whatever you want.
Yes.
Yeah. Yeah.
Well, before we sign off, is there anything else you want to mention, or maybe reiterate how the ladies can get in touch with you?
Yeah, you can find me at theallpurposewoman.com. You can email me at theallpurposewoman@gmail.com. You can go follow me on IG at theallpurposewoman. DM me, ask me all your questions. I would love to hear from you. I'm excited. I'm excited to hear from you, actually. Thank you so much for having me, Dr. Hillary.
Thank you so much for being on here. It was a blast, just like I knew it would be.
It was fun.